I was waiting for a few of our staff members to come down. They're on their way. They're staff members that have been through our CNA school. And we have one student that's here is going through the CNA school right now. But Enrique is the instructor, and he's going to give you a brief overview of what the CNA school entails and how they start from in the classroom and end up getting their license and taking a test and doing skills check and the whole process. Enrique de Luna, ADON.
Hi, good morning. Good morning, everybody. And yes, I just want to go over our actually the requirements to become a CNA in the state of Texas, but not just the state of Texas, but all our country requires someone to be at least 18 years old. Well, different, it differs and. Oh, thank you, yes. Yeah. Oh, better. That sounds better, thank you. Yes, and I just want to go over that. The requirements first is that they have to be, in Texas, they have to be 18 years old, at least 18 years old of age to apply for the program. One of the things that we look for on the employees or the potential employees that they have the compassion, the caring, and want to be the eagerness to start working in the nursing field. For the first thing is that they have to complete at least 100 hours of training. 60 of those are theory, 40 clinicals, hands-on. And then, so then start going to making sure that, first of all, they are safe, working with our population. They can also have a chance not only to work in long-term care facilities, they can work in assisted living, healthcare, hospitals, acute hospitals, home care, and nursing homes, nursing facilities. So those are the places where they can actually work. So they have to be well prepared. They have to know all the responsibilities. First of all, the responsibilities of being a CNA, what entails to be the assistant to the nurse, to the nurse that on the floor, the charge nurse, under the umbrella of our director of nurses, of course. They have to practice. So it's a practice, an act that back in 1988, it became a law that there's a requirement for them to go to a proper training to be prepared to help us work on the nursing homes. Okay. So we have over here several people that have actually gone through the program. We have Ashley Bell. We have Magda Callis. And we have now Gloria, she's currently on the class. We actually had 15 people going through. As you know, there is sometimes with some rotation and what have you. We still have 8 people, 8 of our employees that went through those past 2 classes, and right now we have 8 more students in this class.
How many of those 8 students are from other departments?
From this class?
Yeah.
From this class, there is, I think it's 1, 2, 3, 4, about 4 of them. 4 of them are from other departments. Actually, let me see. Yeah, 4. What's the 4 of them?
We have food service.
I think
we have
4 of them. Yeah, food
and
services,
Magda was
assisted
in
living.
housekeeping.
Yes, housekeeping, assisted living. Also, we just hire as hospitality aides on view to becoming a certified nursing assistant. So they do take a test. They go in. They take a prometrics test to the state. They sit down for a 60 question. They had to pass 4 areas: the area safety, quality of care, quality of life, and responsibilities or knowledge of being the CNA. All those they had to pass with 80% in all of those areas to be able to become the first. That's the first test, the written test, and then they have the clinical test. They actually have to demonstrate 4 tasks within a certain period of time, and they have to pass it with 100%. And it'll be safety, once again, communication, knowledge about doing the task correctly.
And some of our students take the test in Spanish.
Yes, there's an accommodation in the country to be in other languages as well.
So we have two other staff here, Cheyenne and Robert, and they are restorative aides.
Yeah, Robert.
So they're CNAs, but then they have additional training to be a restorative aide.
And our restorative aid program is also they go through training and to make, yes, sir. Do you have a question?
Yeah, define the restorative aid.
Okay, great. Well, the restorative aid program is to enhance and continue to, for the residents to continue to have their abilities, to continue to move around. It's a maintaining, it's an extension of the physical therapy department, which this physical therapy department with our director of nurses, they do plan a care plan to making sure that they have some guidelines to perhaps do some range of motion, walk the resident, dining program too as well, entails different areas of nursing and rehabilitation. It's just to continue to make sure that the residents are independent as possible.
Yeah, the goal is that they stay at the same functional ability. And so they work with residents, long-term care residents that maybe are having some difficulty with range of motion or becoming contracture, things of that nature. So we have, we're getting, I think we have 3 patients that were residents that we're working with right now, and we'll continue to do that. We have about 24 long-term care residents at this time. So I appreciate you all coming, and we're very proud of you.
Thank you.
And someone asked about the CNA program yesterday in director's meeting. So we have not had anybody leave the ARC that went through the class. And the students that tend to take the class are very dedicated to the ARC, and they've worked here some, years. So it's been very successful in terms of retention. And we do thank those of you who donated to our class. We appreciate it, and because the books, we have to buy books, supplies, and things of that nature. So donations are appreciated.
Do you have any questions?
I was just saying, if they wanna make
Is there an
donations.
extra charge or anything when you're in the healthcare for this help?
Extra charge as far as getting into the program?
No, the restorative. No, there's no extra charge for restorative.
Okay.
Yeah.
No, it's an addition.
Yeah, it's an addition. So those who aren't really able to do Part B therapy, those are who we're focusing on. So maybe they've had Part B and they don't qualify for any more, but they still do need some assistance and some exercising.
So the program itself, the senior program starts at 3:30 to 7:30 p.m. Monday to Thursday, and then it's a 7-week length. So it'll be we started on June 3rd, and it'll be done on July 18th.
So, yeah, 3rd class, yeah.
Excellent.
Any other questions? Okay, thank you so much.
Okay, thank you. Okay, if y'all wanna, y'all can stay if you want to. Are you're the staff? Okay. Okay. I'm just gonna talk about the survey. Thank you, guys. So we had, survey at the end of April. I was off hoping to enjoy some fiesta, But knowing that I could be called at any time because it is a surprise, they came in on a Tuesday. And we know when they get to the gate that they're here. So that's the only warning we get. And they come in, and then there's some paperwork they want right away. They want a list of residents. They want a form that talks about the disabilities of our residents. They want staffing information. They want everything. But the other thing they do first when they get here is go to dietary. That's been a trend for 10 years now. I've been an administrator 20 years. And they hit the kitchen. And you wouldn't think that that would be such a big deal, but it really is. Food safety is very important. So they go into the kitchen, they watch a meal service, they taste the food, they take temperatures of the food, and they come to the main kitchen. Now, we were doing fine on that part of the survey until they found a pickle flavored paleta that I had left in the freezer. So, and it wasn't dated. But they forgave that. They forgave that. And we did get a food service tag based upon some things they found here in the main kitchen. A lid wasn't on a trash can. There was some roux on the stove that wasn't, the stove wasn't on, and it wasn't at temperature. So it's really picky little things that they find. So most facilities will expect a tag in food service because there are just so many variables. There's so many ways that you can kind of mess up in food service. And we don't really have control of the main kitchen. We do a lot of training and things in the healthcare kitchen and in assisted living. But, the other thing, beard nets. They were non-compliant with beard nets. So if you have a beard, you have to wear a net over it. And so some of the guys up here thought they were too good to wear a beard net. So that was one tag that we got. The other tag has to do with reporting abuse, neglect, and exploitation. So there was an incident that a nurse spoke rudely to a resident. And the CNA that observed it did not report it to us right away. She went to HR the next week. Well, there are the regulations. You have to report any type of incident immediately to me or to someone else, and they call me so I can start an investigation right away. Now, we were cleared of that incident, meaning we didn't get written up for the incident. It was unsubstantiated, not cited, because we had disciplined the nurse, put them on education improvement plan, and suspended the person. So he paid consequences for his actions, which were just dumb. But the surveyors really felt, and I agree with them, that the CNA should have reported that immediately and not report to HR. You know, we'll tell HR, but that was another deficiency we got, but it's a low-level deficiency. So the third, it had to do with showering, and correct me, Faye, if I'm, okay. So apparently, so we have, Cheyenne's one of our shower aides. We have people on schedules, and they get a shower 3 times a week or more if needed. Well, someone had refused the shower, but the nurse didn't document it. So we got a deficiency for not documenting a shower, or that they had refused it. So we do a plan of correction. We get the report from the state within 2 weeks, and then we go through, and we've already pretty much, by the time we get the report, we've fixed everything. So we do training, we do follow-up with the folks involved. Arlie and the Morrison staff did a lot of training, and when we turn our plan of correction in, we include all those sign-up sheets and the information that we trained on. And then this has been accepted, so this will go on the CMS website at some point. So you'll see, if you go on to, 5-star quality or CMS.gov and look for, the ARC, it's probably gonna take a month or so. You can see our survey and the plan of correction, cause that's published for everybody. So we consider that to be an excellent survey. And a lot of the survey experience, is determined by the team who comes in from the state. Because sometimes you can get surveyors that are with their pistols and ready to write you up and call something, that we call an IJ, immediate jeopardy. So, I have had an immediate jeopardy before, but I, went to the state and got it reduced because it was very unfair. It was during COVID. And we had a nurse who was, he had his pistols and everything, and he was misinformed on a lot of things concerning infection control. And so he wrote the IJ and included all the departments. This was 4 years ago. It included all the departments, and we had to train and demonstrate that we fix the problem, and then they take the IJ away. But it's very stressful on staff, and especially the staff that has to demonstrate whatever correction we have made. Getting to that, so Faye and I, all year, and Enrique too, we're concerned with paperwork. We get our paperwork, our assessments, our charts and everything, and that's part of the survey, is the paperwork part. But a very important part of the survey is the skills. They look at certain skills of our staff, and our staff have to perform those skills. One is wound care. So they'll watch several nurses doing wound care on one of our residents to make sure that infection control is not violated and they're doing it in a correct manner. The other is medication errors. So they'll watch our staff pass meds and make sure that they're, we always want 100% because we don't want to make a med error. So that's another thing that's very important that they look at. And with the CNAs, they will watch them perform pericare. And usually they'll pick 4 or 5 residents, and we get different staff to demonstrate pericare. Because there's a lot of, you think that it's, easy, but there are a lot of steps to performing pericare. And hand washing and gloves and this and that. So it's so the staff have to perform, and I really do admire and thank them for being so well trained, and so and also for demonstrating their skills without being scared, because we have staff that are intimidated by the state, and well, I am too sometimes, but and that don't know that they can do pericare excellent, but make a mistake because of the fear. So they come in on a Tuesday, and Tuesday's usually pretty mellow. Wednesday they're starting to look at charts, so they go into our electronic medical record, and they always pick the people that are the sickest, to be honest, and that require special care. So we know we can predict who they're going to look at, and then they randomly pick some folks, and they look at their chart, make sure their care plan is up to date, their MDS. These are forms that we keep on everyone, and it's very easy to get a care plan or MDS deficiency, but we've been successful the past 2 years that we have not gotten that, mainly because Faye's so diligent with it. So they look at that, and this is while they're still rounding and going around. The 3 surveyors, one was a nurse, one was and then the other 2 were social workers. Sometimes you get a dietitian, but generally they have to be 1 RN and then 2 other disciplines. So we did feed them, which sometimes surveyors, well, they rationalized it that because staff can eat here, they could eat our food as well. So they had fancy food from the main dining room. So they do their rounds, they're doing the paperwork. There's certain forms that are required by Medicare that we fill out. And then they start looking at staff. So they'll give us a list of staff, newly hired, and also a list of staff that have been there, and also all the directors. So me, Faye, Enrique, social work, they look at to make sure we've gotten our CEUs and our education, and that there's been a criminal background check done every year, and that we're not on the employee misconduct, and that our licenses are current. So they go through all that, and they verify all the training. So that can be tedious. HR helps us tremendously with that part of the survey, and it's also easy to, maybe somebody didn't have the training they needed, and you could get a deficiency for that. So that went fine, and we did well with that. And then that's usually on the third day. So the fourth day, you try, okay, you want them to leave, And I always tell the staff, when they all go to the restroom, they're getting ready to leave. Never fails. So they did, and as the week goes on, they let us know what they're looking at, so we can anticipate. And sometimes they'll find something wrong and they allow us to fix it. And we do that, and that's, they used to not, but this team was very forgiving. They love the ARC. They've been here before. It's we have staff, it's clean, residents are happy. That's another thing they look at. They hold a resident council meeting and talk to the residents directly. So fourth day, we're all kind of, tired, hoping they leave. And then they go over all their findings with their bosses at the main office. And then they meet with us and let us know the results of our survey. Now, we can do what we call IDR, informal dispute, and I've done that before. We've gotten things taken off. There was really nothing to dispute in this survey, and so we got the 3 tags, and our stars for survey should be going up. We are 4-star. The staffing, I don't know. They've frozen the CMS until after July. Because for staffing, Gordon and his team have to send in all of our hours every quarter to Medicare. And that's how our staffing score is determined. So they send all the payroll in, the number of hours, the number of residents that we have, and they calculate our star rating. And generally we're usually always 4. Now, if you miss a day where an RN wasn't there 8 hours, then you get dinged on that. So, but Ashley's our scheduler, and she does a wonderful job on making sure we have the staff there when they need to be. So that's the survey. We're getting ready for next year. They have to come in a certain window. So they came in what day? The 26th. So it came in April 26th. So in 2025, they can come in 3 months earlier than the 26th or 3 months after. So they have a 6-month window. And they were actually about almost 2 months late from the last year. So our region has been behind. And it's, it's just part of what we do. So when they come in, they're surveying for not only state licensure rules, but federal. So like for these 3 deficiencies, there are federal tags, and then you have the state tags. It's the same deficiency. But that's because we're a certified facility that we take Medicare. They are surveying for CMS. Texas, the state contracts with CMS to survey for them. Now, the feds can follow. The feds can come in after the state has done their survey to make sure that they did a good job. We had a zero deficiency survey year before last, and that sometimes alerts the feds to come in to make, because they're watching the state. And that's a very interesting situation when the feds are coming in with the state, because the state's, you know, they're nervous, they're like nervous like us, and they can, you know, they can get deficiencies too. Now let's open it up for some questions.
Thank you for your explanation. It really helps us to understand and feel good about the folks that are in healthcare. I have read some information that the RN staffing level is going to be changing in the next year or
Yeah.
so. Can you talk about that and how it should increase the care for our folks, but what kind of a challenge will that bring to the ARC?
Sure.
Thank you.
There's a proposed rule for staffing requirements, and CMS wants facilities to have an RN 24 hours on every shift. Now, I personally agree with that. I think that we do need, not to say that I have LVNs that can run circles around RNs, but I believe that we should have staffing minimums. We really don't at this time, and that's part of it. So we would have to have RNs on every shift, and that will increase the amount of RN coverage per resident. And along with, there's some other requirements as well. Now, what's gonna happen is the facilities that are in rural areas, there's not the pool of RNs that they can employ. So there are gonna be some waivers in some areas. Now, Leading Age and ACA are suing CMS for that requirement. And actually they're going to court in Abilene, and that's a very conservative court. So we don't know what's gonna happen. We staff very well. We're gonna continue to staff very well if this all goes away, but it will affect our budget somewhat, but not extremely. I mean, we have 4 RNs that work with us. Mainly, we have 2 at night, 1 during the day, and then Faye, of course. So we would just have to hire a few more staff to cover
Does
that,
this
yes.
include assisted living areas?
No,
Just,
yeah, assisted living is only licensed by the state. So, the state could do something, but this only pertains to nursing facilities.
thank you.
Suzanne, you mentioned 4-star rating once or twice during that comment. Is our overall rating still a 5-star here?
It is a 4-star, mainly because it has to do with our survey last year, and also our PBJ, they have.
Peanut butter and jelly.
Yeah. So there are some discrepancies with what we sent to them and what they're giving us credit for. But what's the most important is our quality measures are 5-star. That means they get our quality measures from the MDS, the assessments and the things that we send in to Medicare.
MDS medical data set.
Yeah.
Okay, thank
Yeah,
you.
there you go.
I worked with hospice for a long time.
Yeah, so we maintain our 5-star quality, and we watch that very often. You can go down on your quality measures if you're using too many psychotropic drugs. If not enough folks are getting pneumonia vaccine or flu vaccine, those kinds of things. What else, Faye, do they look at? Wounds. They also look at rehospitalizations and things like that. And most importantly, they look at if our residents decline. So our residents, you know, yes, there's decline, but for the most part, with our excellent therapy department and our staff, we don't have a lot of residents that lose their ADLs, that lose their ability to do things.
As a recently retired physician, I'm curious, it's been perhaps 25 years since I actually actively took care of nursing home, that level of care. Is there a feature of this of the surveys that are done that examines physician, facility, communication, and input? We all know that physicians are always warm and caring and never object to phone calls.
Right, they are, yeah. So they look at orders, doctor's orders, to make sure that we're not doing something that we don't have an order to do. They look at all the credentialing information. I don't believe that sometimes they'll talk to the medical director. This group did not. Faye, what am I missing? Faye said she wasn't gonna talk today, but I'm not gonna let her get away with it. So that's basically about what they do. We have one physician that follows everybody. Dr. Soria is our house doctor, and he's available all the time, so that really is an advantage to us. Now another thing that we do that you might be interested is we have to have a doctor of pharmacy come in and review all the medications once a month of every resident. That is a regulation. And that pharmacist will make recommendations to the physician, and we have to show that we followed up, we told the doctor if something, you know, if they change the medication or what. They really look at those forms. They'll look at the consulting reports, and we have someone that comes in every month, and they also destroy our narcotics with Enrique. So it's a complicated business. I don't know, I haven't,
I'm behind you.
administrator in training right now, she's a 30-year RN. And she comes on Monday, Tuesdays, and Wednesdays, and she's gonna come to the director's dialogue on Monday. But this is a crazy business. You have to be a little off to be an administrator.
My question is, in an earlier talk, you talked about aging in place,
Yes,
and I'm wondering how that is coming, particularly with doing the medication care.
yes. So I'm on and Debbie's here someplace too. There she is. So Debbie and I are on that task force, continuum of care. Now our focus was to kind of come up with some, a wish list on the renovation, all that. But now we're focusing back on the aging in place, because that's gonna be a more immediate need than a building or that kind of thing. So we'll be having, sharing some research that we have been doing. We're looking at other agencies, how they come in and provide care. So maybe, we have an agency here that's either owned by the ARC or not, that assist with residents within their medication setup and administration and things of that nature. So that's our goal. That's our goal. And to get more, certainly more nursing coverage in the independent living. So, yeah.
So do you have someone now who can do that?
Well, we have Lucy, but her scope can't set up medications. My goal is to get an RN that works for either John or another agency to come in and assist. Because if you don't have a license, you can set up any kind of license, you can set up meds. But if you have a license, you have to be an RN to set the meds up. Why? That's the crazy healthcare world. Yes.
If we go through this aging in place business, would they be the people that are helping you subject to the same regulations as the people coming in and inspecting you, or would they just be, you get what you get?
Well, so there's two types of, three types of agencies. There's home health, which is a Medicare agency, and they do get surveyed in a different fashion than we do. They will send surveyors to go visit patients. They'll look at the records at the office and things of that nature. Same with hospice, because that's a Medicare agency. Now, John's agency is a personal assistance services type agency, which is only licensed by the state. Now, he gets surveyed too by the state, but it's not as thorough as if someone were billing Medicare. So yes, it would be regulated in some manner. The other issue is that if the help that you're getting is not licensed, you can't file on your long-term care insurance. So it's important that whatever service we get, that there's a license attached so that the long-term care can be billed for you. Bless you.
I got the impression everybody knows the answer to this, because you kept talking about Pericare, and I have no idea what Pericare is.
Pericare is cleaning the privates. Yeah. Cleaning the privates, and that's, and so we do, like when survey, they'll want to see somebody with a catheter. Pericare with all kinds of different residents, but that's what Pericare is. And we try to have the residents participate as much as possible in clean, so, yeah.
In talking about John's business in the
Yes.
personal assistance area, is his PT business, is it separate? And is he also surveyed by the state?
His PT service is actually separate. It's a separate entity. And so when the surveyors come in to survey us, they're surveying them too. Now, and then his companion agency, that's surveyed by the state in a separate process. So when they come in, they want to see John, their education, their license, and those kinds of things, and they go to the gym and examine everything to make sure that there isn't any infection control issues or anything of that nature.
Thank you.
This is Antonio. He is in food service, and he started the CNA class with Enrique on the 3rd. Now, what I didn't go into this because there's two parts to the survey. There's the health part, which I've been talking about, and there's life safety code. So that is done generally by, sometimes they're an architect. The lady that we had this year was a fire chief, retired fire chief from Houston. And they come in and they look at, to make sure that there's no penetrations in the firewalls. They look at if the doors work. They look at our fire drill documentation. They look to make sure we're testing the boilers and that the generator works and that the fire alarm works and all that. It's a very complicated type survey. Now, John, what's his name? Tron, yeah. He was with the surveyor and James the whole time. And she was here for 2 days. And in the past, we've had a lot of issues with life safety code, mainly because it's an old building. But we were only gonna get a state tag, but it is a federal tag. And the only tag we got for life safety code was a light on the new generator. So the rationale is if the generator's not working in the middle of the night and we don't have a light source out there, how are we gonna fix the generator? So that's the only tag, and I'm very proud of James and his team for the improvement in that department in healthcare. Now, assisted living gets surveyed too, but it's not, they send one person in, it's usually just one day, but they'll also send life safety code. So a lot of the same things that they look at in healthcare, they're gonna look at in assisted living, but it's much, it's not nearly as thorough because of the Medicare component that we bill Medicare.
You had a question.
Hi, Suzanne. I had a question with regard to the number of meds. I saw a report from Health Science Center said that they were averaging 17 medications per patient. I know you work hard to get it below
Yeah.
that. Can you tell us how we're doing?
Faye? Yeah, maybe Enrique, can one of y'all? The average number of meds per resident,
It is about 9 to 10.
okay.
9 to 10 right now.
We keep up, Enrique's our quality, quality assurance, whatever it is. And, so every month we go over the number of antibiotics that were, prescribed. If we don't have any wounds, but we would talk about that, the infections, the falls, and, things of that nature. And then we go over that every quarter with the healthcare, board, the healthcare committee from the board of directors.
I have a question. We're discussing the medical aspect of the care that you provide. Are there any requirements for the physical quality of the rooms?
Yes. There's a whole, that would fall under life safety code. And so there's old construction and there's new construction. So if we were to build a new building, there's a little bit different, rules for a new building. And, certainly fire safety goes into that as well. Here at the ARC, I haven't experienced this before and I've been doing this a long time. Everybody likes to bring their own furniture to healthcare. And so, we have, residents with their IL apartment in their healthcare room. Now, we could, because some of the stuff they're moving in is not fire retardant, but they've never raised that issue. And I didn't know this, but when, Alita moves somebody, she makes sure that she sprays fire retardant on their curtains. I've learned that yesterday. So there are some issues with that, but there's, requirements as square footage, windows, door sizes, yeah, grab bars, all those, there are requirements for that as well.
Speaking of safety, what is happening with the benches in front of the?
Alita has ordered some benches for us, and we've left those benches because staff sit there. And some of our AL residents, sit there, but Alita has ordered those concrete-based benches for us to put there.
Great, thank you.
Thank you.
Any other question?
Suzanne, another question with regard to the staffing. You notice that the RNs are gonna go up, but also the CNAs are gonna go to
Correct, yes.
2.2. Is that gonna affect you, and how do you expect to handle that with your nurse training, bringing on the new CNAs?
Well, yeah, we hope that, we'll have our own staff to fill those positions. But, I'll just corner Ashley, she recruits staff and, interviews and things of that nature. It's gonna be tough because we're gonna be competing with hospitals, for wages. And they're making, $40, $45 an hour in a hospital, and they're not gonna come to us and make $38 an hour. So that's gonna be a struggle. We're gonna have to find the pool of nurses that are maybe end of career, or just starting out, or, just love long-term care, because you do have that special relationship with your patients in our setting, as opposed to an ER or a hospital setting. So yeah, we'll be struggling for a while, but I have to say, we never used agency during COVID or since. We never had to use agency, and there are very few facilities that can say that. so. Anything else and fun and interesting on the state? Before we break up, I do wanna wish Maddie Boyd happy birthday. I'm not gonna say how old you are. Have a wonderful day. Thank you. Thank you. Well, we're gonna be back here on Monday, for Director's Dialogue, and so I'll have staff from every area. Assisted living, Lakeside, Crestway, so I wanna introduce and brag on a lot of the folks on our team. We have a wonderful team. I've never worked with such professional and caring people, in my 28 years, but thank you all.